having studies that come out that are starting to look at how do we make at-home living modifications and ultimately, hopefully, improve the quality of life and discomfort in patients that suffer from arthritis, I think is an excellent aspect of things.
Today, we are speaking with Dr. David Dycus, who is a board-certified orthopedic surgeon. He is actually, I know Dr. Dycus through all of our conferences that we have done together. He lectures to veterinary professionals on orthopedic and fracture care and osteoarthritis, and he is in it day in and day out, actually doing the work. So he is here today to weigh in on the results of this study. So thank you so much for being here, Dr. Dycus.
Thank you for having me. Glad that we get a chance to chat and catch up a little bit.
Absolutely. So I did kind of a basic rundown, but if you can just let people know what it is that you do day in and day out in relation to big dogs and orthopedic care.
Sure. So I'm a board-certified surgeon through the American College of Veterinary Surgeons. I have a subspecialty within the area of only doing orthopedics, sports medicine, and rehabilitation. And so I treat dogs, all things bone and joint, from non-operative conditions, in particular patients with osteoarthritis management. My graduate school background is in the area of osteoarthritis, and that's where a lot of my research lies. And then I also see a lot of surgically relevant cases in terms of minimally invasive fracture repair, arthroscopy, total joint replacement, angular limb deformity repair, and that sort of thing. So I've been doing strictly orthopedics for about 6 years now. I also help run an online learning platform called the Veterinary Sports Medicine and Rehabilitation Institute. I am a VIN, Veterinary Information Network orthopedic consultant. I'm associate editor for veterinary surgery on the orthopedic side, and then I'm also on faculty for AO, which is sort of a governing body and the principles of fracture management for both human and veterinary medicine.
Good grief. That is a lot of stuff, David.
That's
okay.
Part of it.
All right. So, I mean, obviously, it's established you know what you're talking about when it comes to this area of dogs' bodies. So let's talk about the Big Barker study. So in reading through it, what were the things that stood out to you from the study, or the most important results to you from this study?
So I think first off, I would congratulate the author or authors for looking at this specifically. First off, osteoarthritis research is extremely difficult because of the ups and downs and a lot of the biasness that can be introduced. And then the other thing that I think is exceedingly important is when it comes to management of OA in dogs, very little to, if any, attention is put into activity modifications, lifestyle modifications, in-home modifications as they are in people. It's one of the things that we just don't talk about. And so having studies that come out that are starting to look at how do we make at-home living modifications and ultimately, hopefully, improve the quality of life and discomfort in patients that suffer from arthritis, I think is an excellent aspect of things. And so, looking through the initial findings of this study, I think it's good that they have strived to not just rely on strictly subjective information. Utilization of an activity monitor, I think, is helpful. It's one of those things where we can gather data when a patient's not directly in the hospital, they're in their home environment. But then also using owner questionnaires that have been validated. And so, utilizing both the Canine Orthopedic Index and the CBPI, or the Canine Brief Pain Inventory Index, is wise decisions in terms of trying to make sure our data isn't completely subjective, and the findings do have some weight in terms of looking further into things.
Absolutely. And so when you're looking at all those results that they got on them, any of those stick out to you?
So, I think looking at some of these where they are showing different percentages of improvement in pain severity score, your pain interference score, joint stiffness, joint function, gait, those sorts of things. It's nice to see that based on the statistical analysis that they decided to utilize for this study, they are seeing an improvement, and they are seeing some statistical significance with some of these things. The big thing is going to be with I lost my train of thought where I was going, because I was looking at the study here as I'm looking at you as well. But seeing these improvements is good. And I think as I read through it, one of the things I thought about, not just for arthritic dogs, but looking at what they saw from the activity monitor, and the fact that they were seeing a decrease in nighttime restlessness and that sort of thing, to me shows that regardless of whether a dog is arthritic or not, having a well padded, well cushioned dog bed allows them to sleep better than if they have, say, not a dog bed and they're sleeping on the floor, or even in the bed. I think one of the things that people love is to have their dog in the bed with them, but what they don't necessarily look at on both our end and the dog's end is the cohabitation of us in the bed, and is it creating restless sleep for both the dog and the person as people move around. Mm-hmm. And so having this dog bed that shows that these dogs were actually getting better sleep, or what we perceive as better sleep, I think is a real plus, and it extends beyond just arthritic dogs, but I could say, from the sleeping habits of dogs in general, there might be something there to help out with.
Mm-hmm. Mm-hmm. And it's interesting that you come up with that as your kind of takeaway, because everybody else I've interviewed, they've also gone to that particular point, and you guys haven't even talked to each other. And all of you were like, well, look, the dogs are sleeping better, and this could be a thing, because we're just now starting to understand how important sleep is to humans, right? Mm-hmm. And so it would make sense to extrapolate that to the dog population as well.
Oh, yeah. I think it's something that we probably take for granted and don't really look at much, and something that needs to be looked at, because just like in people, if we're able to get very good night's sleep and we're not restless and we're not moving during the night, that's going to allow our brains to shut down and allow us to our whole bodies to kind of heal from the day, kind of rebuild, recharge, re-energize, mm-hmm. especially in dogs with arthritic changes, because mm-hmm. these are dogs that are probably exerting themselves a little bit more than we take for granted during the day, because they are trying to move around and be a dog and have a good quality of life, but they're also trying to keep themselves from hurting. And so they're probably burning more calories, and they're overcompensating, and they're utilizing energy in areas at which they shouldn't. And so, having a good night's sleep, I think, is very helpful.
Well, it's interesting because I know that in humans, a lot of the pain research they're going into, as far as the source of the pain isn't in the location where the injury or whatever it is, it's in the nervous system, and the nervous system gets above threshold with the constant pain. And so being able to sleep longer to be able to rest that nervous system, really critical to overall health and wellness, I think. So do you think, so you're looking at those results, right? What are your thoughts on if this is an area of study that we need to do more research into? What are your thoughts on that?
So I think any OA study, especially that's looking at improving or altering home life to go for the dog's benefit, is warranted. Absolutely. The challenge with with OA study is being able to document changes because of what I call sort of the ebb and flow of the disease progression, where we can have dogs that have arthritic changes and they're relatively comfortable, and then we can have dogs that have arthritic changes but they're in a flare up and they're very uncomfortable. And I think having the conversation with owners on altering lifestyle changes is very much appropriate for those patients that have arthritic changes but they're not clinically affected at the moment, versus trying to alter lifestyle changes when they're in the middle of a flare-up. That's where we really need to be thinking pharmaceutical management and getting that under control. In-home lifestyle changes are going to be that population of dogs that have arthritic changes that we tend to either ignore. We know they've got it, but we say, they're not clinically affected, and we sort of ignore it. Or we just stick them on an NSAID and don't ever do anything about it. And so, for me, my whole big push is if we can take these dogs that are in that group where they're not in a flare-up and do as many things as possible to prolong the time frame to the next flare-up or minimize flare-ups, I think I'm all for it. And I think that information is absolutely needed. And it, from a statistical standpoint, it's a matter of making sure that power of analysis is done so we know exactly how many dogs we need to find, and laying out what's our primary outcome and our secondary outcome measures. And then what are our end results? What are we wanting to see? What are we saying this signifies a successful change or not? What margin of from here to here are we saying, are we considered treatment success, in other words?
Yeah, makes total sense. So, and I love what you just said about the difference between dealing with a dog that's in a absolute pain flare-up versus somebody who has osteoarthritis as demonstrated on radiology but isn't necessarily demonstrating clinical signs. So my next question to you is, when you are counseling pet parents who have a dog that does have clinical evidence of osteoarthritis but is not in a pain flare-up, and you're looking for things to do to modify the home environment as far as a modification, would you include a recommendation of like a big Barker bed as part of that conversation?
Yeah, so I think as part of that conversation, having a good quality orthopedic bed that's going to allow them to sleep and not, create undue pressure sources. And so the problem with a lot of orthopedic dog beds is over time they start to narrow down, and so before long it's not much more than just a little piece of foam on top of a hardwood floor. And so there's a lot of pressure points on them when they're doing that, versus having something that is going to maintain its thickness. I've had a big Barker bed for probably 3 or 4 years now, maybe. And it's still just as tall as it was, and I've had 3 different dogs go through laying on it. So, something that holds its weight and isn't going to collapse down is vitally important. And it's the same thing if an owner has lots of hardwood and linoleum or tile. I tell them, let's get some throw rugs or yoga mats or something to create an avenue to minimize slippage. So all those things are great. And I do talk to owners about dog beds and in-home living and that sort of thing. And I think from a sleeping standpoint, it's probably not wise for either a geriatric or a dog with arthritic changes to be jumping up or down onto or off of a bed. And so having a good dog bed that an owner is going to be like, wow, this is a nice dog bed. My doctor said it's not the best for my dog to sleep in the bed with me, but here's something great, because now they're not just having to sleep on the floor per se. Here's a very nice orthopedic dog bed that is going to keep everybody comfortable. So yeah, I absolutely talk to owners about dog beds as well as other lifestyle changes. As
a practicing veterinary surgeon, do the UPenn Big Barker study results impact the way that you think about dog beds as part of management for OA in big dogs?
So for me, well, what's your second question then? Because and the reason I say that is I think that the idea, and I think the initial pilot data is promising to derive information to create recommendations for if we're going to say we need to recommend a dog bed, this is the type of dog bed we want to recommend because we have data on it.
Yes.
With that being said, and I know this is a pilot study, but I'm going to put my researcher aspect into things here and say what I would like to see for me to read this study and be like, whoa, holy cow, this makes a difference, versus me read it and say, okay, cool, they found some things, but it doesn't scientifically change what I'm going to recommend.
Mm-hmm.
So first off is defining the statistical analysis a little bit more. And what do they determine is treatment success versus not? So, what's reported is a lot of percentages of increase. But if you tell me that, 19.9% improvement in the mean score for pain, that doesn't mean anything. For example, if you're using a CBPI, typically you want to see a reduction in greater than 1 or in the pain interference score, or greater than 2 in the pain severity score, to say that treatment was successful.
Mm-hmm.
Anything less than that, you start kind of thinking, okay, there's something here, but it doesn't have a lot of scientific weight to it. And so, rather than seeing percentages and then saying this is statistically significant, I want to see what they're defining as treatment success. And if there's that and you achieve that, then I'm going to be like, whoa, this data to me tells me that this is going to be something that I can recommend because it's backed by scientific data. Mm-hmm. And so that's sort of, when I look at the study, what I derive from it is that I like where they're heading, but I think if the goal is to move from a pilot study into a full study, and the other thing I forgot to mention from a statistical standpoint is I love the fact that they tried to use significant results in an alpha of 0.2 rather than 0.5. So that tightens down the data some. Mm-hmm. And so if you're hitting those success points with that tight of data, my mind's going to be like, whoa, this is amazing. If you loosen it up a little bit and increase the significance level from 98% to 95%, and you hit those points, I would still be excited. So I see the fact that where they set their significance level is amazing from a statistics standpoint. I like that because it creates such tight data, but I want to see more definitive layout of this is what we're defining as treatment success, not just here was a percentage improvement, because that percentage improvement doesn't really tell me much.
Mm-hmm. Gotcha. That makes sense, and that's super helpful, actually. And I love being able to send this back to Eric so that he can see what somebody with your mindset is thinking, because there's lots of you guys out there, right, thinking the same way.
Sure.
And so
exactly.
So do these study results impact your decisions to recommend Big Barker as a therapeutic tool for your big dog patients with osteoarthritis?
I think the answer lightly is yes, it's heading in that direction. The fact that there is some information the way it stands, I think could impact that recommendation. The problem is, I think when you recommend anything to an owner, we need to recommend something specific. So I'm, for joint supplements, for example, I don't recommend joint supplements. I recommend a product. Mm-hmm. For a dog bed, I don't want to say, grab a dog bed, because the first thing owners are going to do is they're going to pull out their phone and find something online, mm-hmm. or find whatever's the cheapest. But in reality, it needs to be, if we're a medical professional, make a recommendation, we need to recommend something specific as to why. And, having a product that you can recommend that does have data associated with it really helps recommend that, because you can say, I recommend this not because I'm getting a kickback from the company. I recommend this because there's this data, mm-hmm. and the data shows this. And I'm very honest with owners about what we know and what we don't know when we recommend things, because a lot of veterinary medicine, we recommend things that there's minimal data on, but we have to make the best informed clinical decision. And we also have to put some clinical experience and common sense into it. Mm-hmm. And me personally already having a Big Barker bed, I'm able to put that personal aspect onto owners, saying, I've had mine, rather than having to buy multiple dog beds because I keep kind of collapsing down, I've had to only have one. And it's still, to this day, the exact same way it came out of the box. And, my dogs tend to prefer it over the other dog beds in the house, because that's where they tend to congregate, is on the Big Barker bed. So I have my personal recommendation that I can put based on my personal experiences. You add in some information with data, and that, continues to increase that likelihood of people being able to recommend it and stand behind it when they recommend it.
Mm-hmm. Well, and I do know that Big Barker, their aim with all of this is they want to be a standard part of the multimodal approach to management of canine osteoarthritis. That is the goal with not only the studies but also the product. And so it seems like it's headed that way, correct?
Yes, and I think that's an excellent strategy, because we're inundated with joint supplements, we're inundated with anti-inflammatories, we're inundated with joint injections, we're inundated with physical therapy and weight control and weight loss and diets. There's nothing on, making lifestyle changes. And so, entering into the area of osteoarthritis is a big avenue to go down, but then they've created a smaller little avenue for themselves because there's nothing else there. So I think that's an excellent idea to try to broach it where we're not just a dog bed, but we want to be part of the multimodal management of osteoarthritis. Now you've gone from, okay, it's just a dog bed, to now we have something else in our arsenal that we can recommend to owners with everything else that we already do. So yeah, that kudos there, because I think that's a great idea.
And absolutely, that is their aim. And I think it's awesome, because it just gives us as professionals another tool that we can use, that we can actually trust. And I know that veterinarians are very, at least the ones that I've had experience with, we do want exactly what you just said, which is specific products, not just, get a dog bed. It's, hey, this will help your pet, not just go on glucosamine hydrochloride. It's, this will actually help your pet and get to where it needs to go. So all excellent points. Anything else I'm missing?
I don't think so. I mean, I think, where the pilot study went was really nice. And the whole point of a pilot study is to see, are you going to see something? Mm-hmm. And then if you say, yeah, we see something, now we can fine tune our study design. We can do our power of analysis, and we can have a really nice study. Because, what usually kills me from a research standpoint and a scientific reviewer and editor standpoint is to see all this time and effort go into a study, and then it tries to push a point, but it didn't meet that. The data didn't support that. And so, having that information from a pilot study and then being able to go back and really tighten down and then get the data is great, I think. And that would really encourage them, because based on what I'm seeing, I wouldn't abandon ship and say, well, the pilot study didn't really do a lot for us, we're going to abandon ship. I would say, I see this and I see there's promise there. Now hunker it down to a really nice, tight study design, and, hopefully get a really nice study out of it that people will look at and say, wow, the scientific data here is really nice. We can trust it. It's well put together. It's good. And as a result of that, we can make this recommendation and feel really good about making it.
So if they were going to do more research into this area, and I mean, it seems like there needs to be some more, what would be, just in a Reader's Digest version, for you to come across the new study of Big Barker? What are the specific salient points that you are looking for that makes you go, yes? Yeah.
So I'm a little bit more of a nerd than most people that pick up and read. So I'm looking at the statistical analysis that was run, the clinical question they ask, and did their study design answer that question? And then I do look at I look at the results and see how they interpreted the results to make sure they didn't mislead that interpretation. And that's why I think it's very wise to, once you statistically know your study is funded appropriately, to lay out what you consider treatment success versus not. Because I think, to me, that creates a lot more weight behind it than just saying, oh, we saw this improvement by this percentage.
Gotcha.
Okay. But what that doesn't tell me a lot, other than I can quote a bunch of numbers, but scientifically it doesn't really mean much. Mm-hmm. And so defining that, I think, is excellent, because then it really is concrete. That's what really makes up a good study is that you've got your objective of your study, mm-hmm. and you've clearly defined what you're considering treatment success versus not.
So what would you define treatment success as?
Well, it's going to depend on what data points they decide to do. So, for example, if you're using a CBPI, I would lay out that we need a reduction of greater than 1 in our pain interference score and greater than 2 in our pain severity score to make sure we meet that. With the canine orthopedic index, there may be a different set of criteria to say, of a percentage standpoint. And a lot of times that's going to be referenced from previous studies, or they can decide to say, well, if we see this much of a percentage of improvement based on this score to this score, then we consider that treatment success in our study. And then the activity monitor data, because there's not a lot to compare to, I think when you start to look at, the fact that you're seeing an increase in less motion or less movement during the night, to assume that they're sleeping better, especially because they let them get adapted to it for those first 10 days before they started counting or looking at that data.
Mm-hmm.
The other thing that will sometimes, at least that I look at, is appropriate long-term follow-up, but as much objective information over subjective information. And so that's why OA studies are so hard to do. So, if there is the budget and the ability, considering, getting these dogs in and doing a objective gait analysis on them, whether it's a pressure sensitive walkway or using a force plate analysis to say, what, not only are they sleeping better, and the owners see that our CBPI is getting better, our canine orthopedic index from our client metrics are getting better. And by the way, because they're sleeping better, because there's less stress on the joints, we're seeing improved gait analysis compared to where they were. Because, a lot of times when we start pulling out gait analysis to these, we start to see that gait analysis and our client metrics don't necessarily always correlate with each other. So, that would be one other thing to consider putting on there. It does introduce more bias, and it makes things sometimes a little more challenging because of, some dogs that may have radiographic evidence of OA could be completely normal on a gait analysis. And so, the question then is, you say, well, if the owner is perceiving a difference and they're filling out the CBPI and we're seeing a difference, do we necessarily need to say that they improved on the gait analysis? Because is that what we're really trying to achieve versus, are we trying to achieve that, we're seeing an improvement in pain and we're seeing an improvement in stiffness and we're seeing an improvement in better sleep? That doesn't necessarily mean they need to walk on a force plate and see improvement. So, a lot of times that's where, having the meeting of the minds to come up with a really great study design. And that's sort of the way I look at it when I look at some of these studies, and then what they did and versus what they didn't do or what I think they should have done.
Well, this has been extremely helpful, Dr. Dycus. So thank you so much for coming in and sharing your thoughts and opinions on this study.
Yeah, well, thanks for asking me. I think it's excellent. I was super happy to see something outside of what we currently look at. Something that's actually looking at something new that we don't have, and I get excited when I see those things. So I'm glad you shared it with me, and wanted to hear my thoughts, opinions, and blabbering ons.
Absolutely. Thank you so much.
You got it.